about what Paw Talks actually is. But after we get these guys home and they become a part of our family, there are certain things that we have a lot of doubt. So can you give us some general tips on certain first aid practices that we can have? When you talk about, obviously we have dogs here, so maybe we can do more on dogs first.
Yeah, thank you very much for a lovely introduction, Srinivas, and good evening, everyone. Pets are our whole life. They add passion and spice to our lives, and we could keep speaking about this. We have a limited time. We'll touch on few topics. Srinivas has introduced first aid. I'd make it a little broader than that. Health is more about prevention and when required, of course, if you have an unforeseen situation in front of you, then first aid is about getting the job done. First aid is about a small burn or a scald or a cut or a small injury, and how you quickly can take care of that for yourself or for your pet in this instance. So last patient we saw last night, we sent home after a bout of treatment for a gastroenteritis. They were getting out of the car. Gentleman parked the car. The lady got out of the car with her husky. They didn't realize there is a dog seated beneath the next car. So there was a stray dog beneath the next car, and this stray dog came and held the husky on the snout and wouldn't let go. And they called us in panic. We just shut the clinic. It was last patient for the day, and so we went back to open the clinic, and their panic call was, "Oh God, she's bleeding. The dog is not letting go, and it's the snout. So the face is very vascular. So she's just going on dripping blood." So this is the kind of situation that all of us want to foresee and prevent if possible. So they had kind of foreseen. They had both of them. It was not one person with the pet. Mummy and daddy were together with her, and many people who are walking their pets will carry a small stake or something. So they had foreseen and planned, but still this happened, right? So it is about trying to think beforehand how to prevent a problem. We have automatic lifts. Pets kind of are very curious and they poke their nose out of a lift to check what's happening outside. So many small things all around us, and we slam shut car door and don't realize, oh God, there was a tail in there. So these are the few things that we want to foresee as far as possible. But God forbid, if something like this happens, you just have to get the job done. Whatever it is, whatever tools you have, whatever you don't have, you still have to stem that bleed or nurse that bruise. A lot of it is just thinking on the spot, presence of mind, and reaching for whatever is just available immediately. So what kind of situations need first aid? So these are few simple injuries, or God forbid some hot liquid spilled. Simplest thing you would do is just douse with cold water or ice water and try and reduce the temperatures of whatever got scalded or whatever got injured. So this is the kind of thinking we all apply for ourselves, and we'll continue to apply for our pets. So anything you'd have to add?
So for a bleed, maybe you can just press down on the bleeding point, and if there is an eye injury, you close the eye and put some ice on the eye. So these are simple things that you would do for yourself, you can do for the dog as well. But yeah, being careful is the first part, but yes, accidents can happen.
So as they say, prevention is actually better than cure. That actually leads us to the next question. What are the basic first aid things that should be there in my doggy first aid kit? Absolute basic first aid things.
Yeah, I think it will come if you're looking at a kit that you want to maintain for your pet at home. It will come to basic drugs. It might mean like a simple Ondem, which you might use for yourself, or a simple paracetamol, or I think the list is pretty short, but these are the few things that you should probably stock if you're traveling, or other simple accidents that we should try to prevent would also include heat stroke. we live in a very, very warm country. There's 10 months of summer. Just now we're in the middle of a little cool weather, but almost all through the year we have very, very hot weather, and our cars can get really hot, and heat stroke can happen in matter of 20 minutes. If your pet is in the car and the AC was not working well, or you couldn't find a shaded spot to park the car for those 20 minutes, heat stroke is just around the corner. Unfortunately, neither cats nor dogs can sweat, and because they can't sweat, they don't have the ability to lose body heat, and heat stroke can be really disastrous. It's very difficult to understand what's really happening to a dog in heat stroke. You have to see it to believe it. I hope you never get to see it, but maybe you should look on YouTube and understand how to identify that this is heat stroke. Dogs feel warm all the time. Dogs feel warm all the time to touch, and their normal body temperature is a touch higher. So you might not realize that the warmth is little much more than normal. Many times dogs will be panting or drooling a lot. There'll be tongue lolling out, because it's the only way the dog can attempt to lose body heat, because there's no other surface area of the body that can help the dog lose body heat. So sometimes dogs may turn delirious. They might not respond. They might not look you in the eye. They might turn delirious. They might be flailing, or not be able to understand where they are, because like Nanima tells you, if the high temperature reaches your brain, then delirium is right just around the corner. So you might remember, as kids, Nanima would put a cool strip on your forehead saying, "Bacche ko bukhar hai, I cannot let it reach the brain." So these are the very broad and general signs. It's very difficult because it's not a fixed pattern. Different patients might show different kind of signs. So checking a temperature rectally, this might be a vital skill. Should you have a thermometer in your home? Yeah, I think you probably should. You might have for yourself. You can pretty much use a similar thermometer, a digital thermometer that you use for yourself. A similar one you can allocate for your pet. And maybe you should train your pet. We have trainers here. These are life skills. Maybe we should train pets to permit us to check temperatures at home. It should not be that I have to reach the vet and then they check the temperature. Temperature checked at home can be accurate and can be informative and can help you do that small thing which might just render immediate comfort. So simplest thing, if your pet has a fever, or God forbid has a very high fever which is called a heat stroke, is to douse cool water straight away. So people may have, sometimes people voice concerns with us saying, क्या उसको सर्दी लगेगी, will he get some kind of common cold or influenza? It will not happen actually. In fact, it will be interesting for you to know that if I'm a 5-day-old child were to have a fever, they'll take a bucket of ice water and dip 5-day-old child in ice water straight away, because your 5-day-old child can't receive paracetamol. Okay, simplest medication that we all rely on to control temperatures. A 5-day-old child it's not safe to administer to a 5-day-old child, and you'll just douse chilled water for a 5-day-old child. So you do pretty much the same. If you think there's a fever, you should do a cool sponge, and if you feel there's a very high fever, maybe you should just hose your pet down. It's not going to harm at all. It cannot really harm, and it will do what sweat glands do for you. Your sweat glands cool your body off, and the cool water that you douse can get that temperature down quickly and save your systems, organs and systems from facing the problems associated with high fever. So many of these small tip injuries are common. God forbid, you're walking your pet, unlike my patient of last night, some other dog attacked and tip of the ear got nicked, So this can bleed a lot. Amazingly, tip of the ear or tip of the tail type injuries can bleed a lot, and maybe a pinch of, turmeric or a pinch of Nebasalf, some of those things can just help cake the medicine and generate a clot over it, and till you reach somebody who can do something more complete or more perfect. You should help stanch the bleed. So simple bandaging techniques. Sometimes you're walking your pet and the toenail can get injured. Toenails can also bleed, and some of these, if we have thought ourselves through these situations, you can do a lot. a simple band-aid, if you can generate dryness around whatever bleeding spot, on a dry area, the adhesive tends to stick very well. And if you can dry the area, then a simple band-aid can stick very well, and just in a smaller space you can generate some pressure which helps stop the bleed. So these would be some simple interventions that you could do, whether it is tip of the tail or tip of the ear. Of course, on the face it's little more difficult, but a small band-aid on the tip of the ear can really help reduce or control bleed very quickly till you can get some formal help too.
Lovely. Ma'am, this is for you. Some minutes ago, I was talking about Dr. Google. A lot of people generally tend to, and nowadays we have a lot of these online apps that actually tell you what medication is for what. As humans, we tend to self-medicate a lot. For example, today, even a little bout of sardi, we start popping antibiotics for ourselves, which is causing a lot of resistance amongst us. So, it's a little, so two sub questions. One, why should we be careful during self-medication for dogs, as well as why there are certain medications that you should never really utilize without checking with the vet first?
So there are certain medicines which we will easily have. People like NICE, ibuprofen. You have a toothache and you will pop a NICE or an ibuprofen, but my dog cannot take it because my dogs cannot, the body cannot throw the byproducts out, and then it affects the kidney. So let's say if my dog is having fever, the first thing that I would give is paracetamol, which is comparatively safer than anything else that is used. So, Google will also tell you that do not give NSAIDs to my dog. So that is something that Google is correct about. But definitely, if your dog is having any problem, you should consult your vet before giving any medication. Self-medication can sometimes be incorrect for the dog. The dosing might be incorrect. What you would have yourself, the dog, the dosing will be different.
Yeah, so I mean, I'm 80 kg, so if I give a medication that I take to a 10 kg poodle dog, then it's going to be a big problem. Any particular, so you mentioned things like ibuprofen, etc. Any particular, applications that we use for ourselves that should not be used on dogs as well?
The same like Voveran, Movera, whatever creams, Addicts. What you would use for a simple sprain, you should not be using for your dog. One, if the dog licks, he will start throwing up. And, if he licks so much quantity that the kidneys get affected, that shouldn't be the case, because whatever quantity is there in Addicts, I'm sure the dog is not going to lick up the whole thing. But yeah, that's something that you should be careful about.
So, basically, do not self-medicate even if you do check with your vet. And
you should definitely check with your vet before medicating your dog.
Before doing any kind
simple
of medication.
Simple thing, paracetamol is okay. Or let's say you're traveling with your dog and the dog starts vomiting. So, simple thing like Domstal can be given, but correct dosage is important. So, before traveling, maybe consult your vet and take a note of what medicines should I keep handy. So I always, if somebody is traveling, I always give them a list of what you should have these 3 things on hand. And if there are loosies, you give this. If there is a vomit, you give this. If your dog is having fever, give this. So this is what you should have handy with you.